You can only choose 3 exercises to complete each day for the rest of your life. Mike, what 3 are you choosing? Thank you for tuning into the Prehab Audio Experience. This is your host, Dr. Dillon Caswell. On today's episode, we are joined with Dr. Michael Lau, and we ask him if you could only pick 3 full body exercises to do for the rest of your life, what 3 exercises are you choosing and why? He then flips the script and asks me the same question. We both give our top 3. It's a great episode. We hope you enjoy it. Today's show is sponsored by the Prehab app. This is not just an app, but a solution. You have the opportunity to take control of your rehab, prehab, fitness, and performance needs, all from the palm of your hand. The app is available for download on the App Store for both Apple and Android users. Also, a free 7-day trial is available. Don't wait. Start taking control of your movement health today. You don't want to look like the picture of health on the outside, but have no idea what's happening on the inside. Our podcast sponsor, InsideTracker, is here to help. It was created by experts in aging, genetics, and biometrics from Harvard, Tufts, and MIT. InsideTracker provides personalized health analysis and clear recommendations from 44 tested biomarkers, plus an action plan on how to make changes to live a healthier and longer life. Along with accepting nearly all forms of payment, you can use your HSA, HRA, and FSA to buy any InsideTracker plan, and for a limited time, you will get 20% off the entire store when using the code PREHAB. You can visit the website by visiting InsideTracker.com/prehab or check the link down in the show notes. Go and check out a plan, enjoy 20% off, and start optimizing your health from the inside out. Prehabbers, welcome back to the Prehab Audio Experience. This is your host, Dillon Caswell. Have you ever seen the show Alone? I find it fascinating. It's survival experts. They're casted and they're sent into really the harshest environments with the goal of just surviving and outlasting the other 9 contestants. Whoever survives the longest, they get $500,000. But the fun part of it is they don't know when the other people tap out. So they're just trying to survive as long as they can. They're allowed to bring just 10 items with them. With these 10 items, they have to see how long they can make it. They have to fight off loneliness, hunger, and being hunted. I think the last season that I was watching, they're actually in polar bear territory, and polar bears are one of the only animals that actively seek and hunt their prey. So in most episodes, they're hunting their animals. Now in this one, they're being hunted. So they're in polar bear territory, which is just terrifying. But on today's episode, we have Dr. Michael Lau on, who is not in polar bear territory, but is here to help flip the script a bit on this concept of alone. Mike, thanks for joining us today, man.
Oh, I love that, man. I got to go watch that show. We are going to flip the script on that concept. We're in LA, so we're recording it. It's cold. LA is not supposed to be cold. I do feel like I'm in polar bear weather right now in territory. I've been wearing sweats every day. I got like parka and jackets and beanies. I'm inside right now, but it's cold for a Southern California kid right now.
Yeah, for sure. I remember, I think it was a year or 2 years ago, I was chatting with Craig, and him and his wife were out to dinner, and they turned a corner and there was actually a bear that was in LA. It wasn't a polar bear, but it was probably like a black bear, brown bear, but it was like on the streets of LA. And I was like, dude, what did you do? And he goes, we just ran. We turned around and booked it and took off from there. But Mike is safe. He's not around bears, but we're going to flip the script a little bit. And instead of talking about these 10 objects for survival, we're going to ask this question. You can only choose 3 exercises to complete each day for the rest of your life. They can be compound multi-joint movements, but the trick is that you only have access to your body in a longer resistance band. So 3 exercises, compound movements that can be isolated, that can be compound movements, but you can only use your body in a longer resistance band. Mike, what 3 are you choosing?
Let's do it. Let's go 1-to-1 on this. I think
I like that.
I'm gonna speak for me personally, and then I'm gonna go over the rationale, then speak to what I would recommend for the users. For our audience here. So the first one, I'm also gonna keep it a little simple for me. I'm gonna go no equipment for me. So I don't oftentimes have a band on me. I only have it at the gym. So the first one for me is gonna be some sort of mobility or general movement exercise or routine for a targeted area that I have issues with. For me, I have chronic low back pain. I get an episode maybe once a year. It used to be really bad. It would knock me out for like 6 months the first time I had it in college. Now the last one I had was maybe like a 2-week episode. So the thing that I do is cat cows or cat camels, just some sort of low back, end range flexion, end range extension. If this is you and you got ankle issues, I would have to be some sort of ankle dorsiflexion exercise. If you got shoulder issues, it'd be some sort of shoulder mob. If you got hip issues, it'd be some sort of hip mobility exercise. So some sort of just movement. I don't care what direction it's in. I don't care what plane of motion it's in. Just movement that feels good, that you can explore the entire joint's capacity every day. Like that's what I would definitely recommend. What about you?
Yeah. So you're already getting to this point that I have to choose three. The first one I'm choosing, I'm going to individualize it to my experiences. I'm going to individualize it to the past injuries that I've had, the past experiences that I've had, to make sure that I can achieve this goal of being able to get around day to day because I'm taking care of these previous things. And we know that there's a lot of risk factors for injury. It's multifactorial, but the number one risk factor is a previous injury. You know, if I've had a previous injury in that area, I'm going to be taking care of that specific area. So for me, the first one that I chose, kind of a similar approach, is I went with a Copenhagen. The reason I went with a Copenhagen, and people that have listened to this podcast, they know that I just have a love for the adductor magnus. It is one of the most important muscles that we have in the human body. We did a whole episode dedicated to the role of the groin and why we need to train the adductors. But the adductor magnus and the adductor group, we look at a textbook and we assume that it just does this motion of adduction, bringing the leg back into midline. The thing that we forget is that muscles don't know their job. They don't know their role. They just know that I should contract or I should relax because the nervous system is telling me to do so. So the adductor doesn't wake up and go, today I'm going to squeeze my thighs in and try to crush a watermelon. You wake up and your brain goes, okay, let's move this way. I'm going to use this pattern to make this thing happen. So the adductor, if you're in hip flexion, it's a powerful hip extensor. If you're in hip extension, it's a powerful hip flexor. It can do some rotations, but it's such a powerful muscle, but it's oftentimes neglected. So for me, that's an area that I do injure kind of time and time again if I'm not training it, is this adductor group. So I'm just going to say a Copenhagen variation, right? Yeah. It can be like an incline adductor side plank, an adductor side plank. If you have like, we talked, you get a band and you get a body. Well, if there's a rock or a couch around, like prop your leg up and do a full Copenhagen. The other reason I'm choosing a Copenhagen is that one of the most neglected areas, also aside with our adductors, is our lateral core musculature. And when you're doing a Copenhagen, you're not only getting the adductors, but you're getting your lateral core. You're getting a side plank. And Mike, when we were prepping for our new app, and we went through and audited all of our programs that we have for all these different body regions, I started taking tallies of what's the most often movement used in any of our programs, from mobility to rehab to prehab to performance to fitness. The number one exercise that was used and the number one assessment that was used was a side plank. Yep. So restricted to these three exercises that we get to choose from, a Copenhagen, we get a side plank and we get the adductors combined into one. So that's why I went with that one.
Yeah. And again, we're, so for you and I both, it's a mix of personal experience, personal history, right? Like you have an injury history in the groin, you love the groin, but we also know that the risk of groin injuries is really high in any multiplanar athletes, which is essentially any sport if you're moving in multiple planes. So we're choosing the adductor, the groin for that. And for me, again, I've specified just on myself, like I'm going to go to the low back, but it could be mobility in any region. And we know that certain regions need more mobility, right? We have the ankle, the T-spine, the shoulder, the hip. So if I had to speak in general terms, so like when we designed the full body pre-ab program, I don't know John or Sally who's going to be using the program, but I know what the 4 or 5 regions in the body that we know need mobility. So if I had to go one exercise for that, it'd be world's greatest stretch. That hits on everything, especially there's a version that I like to do where you get into that runner's lunge, you go really deep in there. So you get the back leg hip extension, you get the front leg hip flexion, and you can kind of abduct your knee a little bit. So you get the groin opened a little bit. Then you go into a nice little, like thoracic rotation one way. I like to push up and then into a down dog, butt goes in the air. So I get my hamstrings, I get my dura, my nerve. Then I go rock back and forth with the calves. So I get the little calf stretch in there as well. And then I go into an actual up dog as well for my low back. And then I switch to the other side. So it's like that basically full body mobility exercise, kind of hitting all the different regions that we know people need mobility in. That's like my go-to. And honestly, those are the two when I lift and do anything, even before I play tennis. The two exercises that I do, no matter what sport it is or what activity, actually for me is a cat camel and world's greatest stretch for those two reasons.
Yeah. Well, Mike, you sold me that I'm going to start adding that into my routine, because I constantly joke around like a down dog position is difficult for me to get into. Like I have to really work to get in there. And, I've only been to a few yoga classes, and I stopped going because I always felt like I was disturbing the peace and the flow of the yoga class, because I'm like in a down dog, just like grunting and the instructor's like, breathe through. And I'm like, I'm trying to breathe, but this is just tight. It's hard to get into these things. Yeah. So it's funny because we can do these incredible things like gymnastics, like ring muscle ups, handstand push-ups, Olympic lifting, but doing like this world's greatest stretch, exploring the different mobility that the body has, it becomes really challenging to do that if you haven't done it before. So that's definitely one that I need to work in there. But Mike, what's your second exercise? What's the second one you're choosing?
You stole the thunder on talking about the side plank. So essentially, like, I love the side plank. My exercise, to answer your question as concisely as possible, is some sort of side plank variation, specifically on the knees. Any side plank variation on the knees. One of my favorites is the side plank clam. And you hit it a lot when you described the Copenhagen. And I didn't mention it when I talked about the down, or the, I keep mentioning switching down and up dog. The up down dog, when my butt's in the air, which is confusing in my mind. The down dog is that, so for example, on the down dog, we're doing that typically. A lot of people are doing that for some sort of posterior chain mobility, right? We're getting the hamstrings, the dura. But if you can cue it correctly and cue it properly and really drive through your elbows and drive through the hands and really push that floor away from you, we're getting a great upper body activation, upper body shoulder flexion. We're getting great mobility and activation in the upper body. Same thing with that Copenhagen or side plank. People typically are programming, we'll just say core. If you walk up to 100 people on the street and you say, I'm doing a side plank, like, what muscle am I targeting? Again, we're targeting everything in the body. The body doesn't know what we're targeting. We're just, again, using it. We're telling it to contract. People are going to say core. But you already mentioned it, like in a Copenhagen, you got great adductor work. On the side plank, we get great hip abduction work. In my shoulder girdle too, I got to work on stabilizing my shoulder joint and putting my shoulder in a good position that's not maybe too high or too low, and really driving my elbow into that ground and working on the stability of my shoulder. I got to work on my head. I can't just have my head flopping over. Got to keep my head in a nice neutral-ish position. And now I'm working on the side mid muscles. I had not a concussion, but I remember going back from snowboarding and I hit my head. It was hard for me to just like lift my head on the side. And you don't realize like how much we use those muscles or how impaired they can be when we have some sort of upper neck injury. So you got to keep your head level there. If your side plank is on your feet and not on your elbow, you're driving your bottom leg peroneals in the ground. You're using everything on that lateral leg. It is a full body exercise. Like if you go like RKC style and you really ramp up everything in your body when you're trying to hold a side plank, it is so much more than the core. And that's why for me, a second variation, now generally speaking, it would be any sort of plank variation, but specifically with movement. I like plank variations with movement. So it could be a side plank with the clam. Could be like doing getting into like a quadruped position or a bird position and maybe doing bird dogs. It could be a star plank, something where I'm moving, because then my core has to stabilize. I got to keep that nice and still. I got to keep my body nice and strong and stable while something else is moving, which is essentially almost how the core functions in real life. It's a force transfer from the lower limbs, oftentimes to the upper limbs. And we have to be able to transfer force from back and forth. So any sort of plank variation with movement would be my general go-to.
Let's take that quick BRB break and hear a message from our sponsors. We spend a good amount of time cleaning plaque out of our teeth, but do we spend enough time learning about potential plaque in our bloodstream, and how would you even go about this? Don't think too hard. Let InsideTracker serve you with their ultimate plan that now includes apolipoprotein B, an essential indicator of heart health. ApoB directly measures the concentration of plaque-building particles in the bloodstream to give you a clearer picture of your cardiovascular health status. Embrace the data-driven approach to health and longevity. Try InsideTracker's ultimate plan, now with ApoB analysis, link available in those show notes below. Let's take that quick deep breath. And get back to the show. Yeah. Wow, Mike, there's so much in there that we can chat about, but I'll kind of summarize that really quick. So in the down dog, cueing to press into the ground and activate the shoulders. A lot of times in shoulder rehab, we're talking about we need mid trap, lower trap, and serratus activation. We need this posterior tilting of the scapula. We need upward rotation. We need a little bit of protraction that's balanced with the amount of retraction that's happening. What a beautiful way to get that is by in a down dog. Now you're getting posterior chain mobility, like you said, the nerve roots, the dura, all of this tissue is being lengthened out, and you're getting motor control, stability of the upper body. I love what you brought up too about the side plank. When you're positioned on your elbow, you're getting a lot of dynamic stability if you're adding in other body movements. And we did a rotator cuff podcast with Arash. It was a 2-part series. How do we contract the rotator cuff? A lot of people say, oh, you do external rotation. Get a towel under your arm and do external rotations with the band. Well, the rotator cuff contracts reflexively either by distraction or by compression. And distraction is not like a bird flies by my window, so I look at that and I'm distracted, so my rotator cuff contracts.
That'd be kind of cool, though.
It'd be kind of cool. But the distraction is that my joint's being pulled away, right? So for example, like a deadlift, if I'm hanging onto a barbell doing a deadlift, there's a distraction force going through my shoulder that the rotator cuff's going to contract and say, you're staying here. I'm stabilizing you in this position. And then compression, when you're weight bearing, you're putting your forearm down on the ground, and those forces are coming up, the rotator cuff dynamically is going to stabilize that. And that's the role of the rotator cuff. We say it's external rotation. No. It's a dynamic stabilizer first, external rotation second. And for all we know, yes, the rotator cuff does external rotation. So does the posterior delt. Maybe it's the posterior delt that we're actually training when we're doing these things, and EMG studies we need to look at them. Is it surface EMG or is it needle EMG? Are we getting crosstalk from these nerves? But anyway, dynamic stabilizer. Want to work the cuff? Dynamic stability. We can get that in a side plank, and the side plank is really one of the best exercises that we can have. So my next one, Mike, that I went with, it takes a similar type of methodology, but adds in a balance component. Like a side plank, you're still balancing, but you're down on the floor, so it's not as difficult for balance. So the way I went with this is it's a single leg deadlift using the band with a row. So when you get opposite arm,
standing on the band.
Standing on the band. And the row is going to happen when your leg is kicked back into the single leg deadlift. So the body's horizontal, you're standing on the band on the stance leg, one leg's kicked back. The opposite arm is now pulling this into a row, right? So why this one? Well, single leg stability. We've seen how important single leg balance is, especially as we get older, that we don't want to lose our ability to just have balance. The second reason is that we need to pull more than we need to push. So many times we see shoulder injuries because people are just pushing way too much, whether it's in their exercises, whether it's in their daily routine, but they need to pull more. And Dr. John Rusin that came on the podcast, they found that if you have your volume 3 times higher with a row compared to a push, that creates a healthy shoulder for the long term. We see that low back injuries are number 1, but shoulder injuries are creeping up as a close number 2 as the most injured area in the human body. So we need to do more shoulder care. And the best way to do shoulder care is, we talked about it in the side plank, but now let's get pulling happening. And when we're doing a row and we're getting retraction, we're getting all these posterior muscles of the shoulder blade that allow it to happen. And I love this exercise because of how much is engaging with it. Yeah. Mike, you're mentioning like neck control. Well, you have to have neck control with this one too, or else your head's just going to flop down into flexion. You also don't want to be too much into neck extension. So you got to keep this neutral neck position. And now you're up against gravity. When we were trying to pick an image for full body prehab, like what's one picture that we can put to sum up this entire program? This was the picture. Yeah. Because it hits all the things that we need to: anti-rotation, single leg balance, pulling strength, posterior chain strength, deep neck flexor endurance, all that packaged into this one movement. So I went with that one, using the band to get a little bit more with that resistance. And Mike, I'm going to take it the next step further. I'm going to add tempo to it. Right. We didn't say that tempo was not allowed. So I'm adding tempo into it.
And what's the tempo you're adding to that one?
So the tempo that we're going to go. So if tempo, you're wondering like, what the heck does tempo mean? It means we're going to perform this at different speeds. So there's an eccentric part to the movement and then a concentric part. The eccentric part is when you're kicking your leg back and you're lowering yourself down to get horizontal with the floor. When we're doing that, we're going to go with a slow tempo, and 3 to 5 seconds, nice, slow, controlled. When you get to that point where your body's horizontal, you're going to hold that isometrically. You're going to hit a row, let go of the band. And now when you're coming up from that position, we're going to have you come up as fast as you can, as quick as you can. So we're starting to develop rate of force development. We're starting to develop some speed to it, which we need some power. And I'm sure we'll dive into this a little bit further, but we want to start adding that into it because, again, we have 3 exercises that we're choosing. So it's not just the exercise, but it's how is this thing going to be performed to set me up for longevity. So that's the tempo that we're going to add into it.
Dude, that's a great point. Let's expand on that. And like people are so fixated, and we went along with the fixation by having the topic of only choosing 3. Like we went with that. But yeah, what people don't realize is you can modify so many minute details of an exercise like tempo and be working on a whole different subset of something in the human body. So for you right there, with the example that you had with the RDL row, you wanted to work on rate of force development concentrically. So the muscles are getting shorter, specifically like the posterior chain. So you worked on it accelerating from that kind of bent over position on the way up. You can use that same, we can just stick with tempo, and we can do that same thing, but now work on rate of force development eccentrically. So that's like taking that band, getting it as tight as it can standing up, or even if you had a dumbbell or something, and like dropping as fast as you can and then trying to catch yourself. And now it's a whole nother goal. It's a whole nother human movement, like capacity that we are working on, but it's the exact same movement, the exact same equipment, it's basically the exact same thing. We just changed one little thing, and we can do that with so many different exercises. And while it is important to have variability in movement when it comes to prehabbing your body, to bulletproofing your body, even variability in small things like tempo or what piece of equipment you're using, a kettlebell versus a dumbbell, and make a big difference. And just switching things up like that really is the key to longevity in my mind. You can't get stuck doing the same thing over and over again. And you mentioned the importance of pull over push, like things that are fun, like bench press is fun. Like most guys are going like, I want a bigger chest. I want to have wider shoulders. Like don't not bench press because it is fun. And like, that's a goal that you have, but do all the other things that maybe aren't as fun, the pull motions, like you're saying, and incorporate those things. And with full body prehab, that's what it's about, because we already know what the popular things are that people want to do that they shouldn't stop doing. Like I'm going to keep bench pressing, but let's hit all the other things that we know that can help not just increase the longevity of the shoulder for bench press, but maybe even help your performance on the bench press as well.
Yeah. And this is where we typically hear it's an art and a science. Like we have the science showing that if you do this particular movement, you're going to bias this muscle group. You're never going to isolate a muscle. There's always going to be a lot of muscles working to achieve that motion. So we have to think in patterns, but the science can help us to start biasing that, hey, these muscles that are doing an upward rotation of the scapula, they've become deconditioned because of this test that we've used. But now there's an art to it of, we're not just going to sit there and do a Y. Like that's a great starting position. But if the person is shrugging their shoulder up and they're just throwing their arm out in front of them to get into a Y position, like that's not a great movement for that person. So we're going to have to use these little nuances, these little changes that can really go a long way. And to any provider that's listening, or physical therapist or student or personal trainer or anyone in that realm, this is where it becomes imperative that you are an expert of the movement system, because you have to know these little nuances that, for example, with a Copenhagen, right? If I'm doing a Copenhagen for the adductor, but the person is turning their foot upwards, they're now targeting their hamstring.
Yeah.
So now their adductors aren't being worked the way that we want them to. So we might go, well, this doesn't make sense. We put Copenhagen into the preseason hockey program, but now all these hockey players are having groin injuries. Yeah. Well, if they're all turning their foot up, you actually we're adjusting the hamstring, not the adductor. So these little nuances do matter when we're after a particular goal. If you're new to movement, we don't really care too much about the nuance, because we just want you to start moving and feeling confident. And then once you develop this base, now we can start getting into those nuances. So, you know, it's definitely, there's two sides to this of like, don't scare people away with the nuance, but once they've built up capacity, now let's start diving into these little things that will make a bigger difference for them.
Yeah. And early on, building up to these more complex movements like that single leg RDL row, that, like you said, it requires so many things. The coordination just to even pull off a single leg RDL for a lot of people is hard enough. That's why I love with all of our programs, every week builds upon the others. Like you don't just start week one with a single leg RDL row. Can you do a row first? Cool. Can you balance on one leg first? Cool. Can you do a single leg RDL without a band first? Cool. Can you add a band? You know, there's layers to movement, and that's how we can teach people to move more effectively and better. Find a challenge for them, but it's not too much of a challenge. Let them do that for a week. They develop competency with that movement skill. Now add another layer on top of it. And we can just keep adding those, like you said, those little nuances to build someone and make them more robust.
Yeah, absolutely. It's like we think of these big progressions, but within these big progressions, there's micro progressions that we can be using to make people successful. And that's where the bread and butter is with programming, those little nuances that people don't realize, that then they achieve this bigger goal. Like that's the fun part with creating a program or a workout. All right, Mike, so we hit 2. I think we got 1 exercise left. What's your third one?
So the third one is kind of funny. And I mean, and for everyone listening, Dillon and I did not talk about the exercises at all. We did not give each other any like hints about what we were going to do. Just I knew the topic was going to be choose 3 exercises. But it's funny, everything I've said, then it's gone back and forth, which is great. Our minds are thinking alike. You had mentioned in your single leg RDL that one of the reasons why you enjoyed it a lot or wanted to choose it was because of the balance component. And balance is something that we know decreases a lot with aging, and that's why I chose my third exercise. I had it as a broad jump. So I wanted it to be any power-based movement with your body weight. We do know that, as we age, our balance deteriorates a lot. But what's the subset of what's deteriorating? It's our ability to generate power and generate impulse. So for me, I like the broad jump. It could be anything. It could be a box jump, could be a squat jump. I like the broad jump because there's just, again, no equipment needed. I don't need a step. I don't need a box. I do like the more horizontal vector for me personally, for the knee, for the deceleration, or for the hip. But something that has some sort of, power-based activity, I think is so important for longevity. I'm guilty of this myself. Like I'm getting back into tennis, but when I think about what I do in the gym, I'm training and doing stuff because I want to get stronger and maybe bigger as a secondary thing. Not that I want to be more robust, more resilient, and more athletic. That training is the power-based stuff, the speed, the stuff that sucks, the stuff that you're breathing hard and you don't really like how your body feels after 20 seconds of it. But that's the stuff that's super, super important when we're talking about building as resilient of a body as possible. So that's going to be my third one.
Yeah, great choice. I was just talking with one of my buddies who he can deadlift 500 pounds, but we played a pickup football game and he strained his hamstring.
Yeah.
And he's like, how did I strain this? Like I can lift 500 pounds, but then it's the realization of, well, lifting 500 pounds isn't specific to what you're doing in these activities that are a little bit more sport specific. So, like squatting is great, right? But in tennis, you're moving laterally. You have to use jab steps. You have to decelerate and accelerate. You have to do that for a long time, right? How long is a rally going? So you have to be ready for those movements. I love that you added a broad jump in there for explosiveness, where the approach I went with was, let's add the explosiveness into the tempo work, but a broad jump is a phenomenal exercise. So the last one that I chose, and one way I wanted to go about this as well, is that what are the most common tendon and muscle injuries that we have in the human body? And there's a lot of data showing that it's pretty common, that it's rotator cuff tendinopathy, gluteal tendinopathy, adductor tendinopathy, hamstring tendinopathy, patellar tendinopathy, and Achilles tendinopathy. So when I was choosing these 3, my other thought was, how do I address all of these things to prevent these tendon injuries and muscle injuries from happening? So stick with me on my last one. My last one is a single leg squat in an isometric heel raise while doing a pail off press.
One leg, single leg.
Yep, single leg. So
that's got to be a heavy band. You got to support yourself. Oh, okay. Single leg squat, not a. Okay. All right. I think you can do that.
Yeah. So the bands for the paddle off press, it also adds a little bit of stability and a little bit of balance, because we want you to maintain the heel raise position, because you're getting your soleus, you're getting your gastroc, you're getting your Achilles, which then is going to help with the plantar fascia as well. So we're targeting that area. When you go to squat in the heel raise, it's likely that your knee's going to come in front of your toe. So we're getting the patellar tendon, quad tendon. And then you're also stabilizing with the glutes and with the adductors to have medial lateral compression there. And then the paddle off press, I wanted to include some type of press for the upper body. Like, we're doing a lot of pulling with the row. Let's do a press so that we're not missing out on that, because the rotator cuff does actually activate in pressing motions as well. We tend to kind of have this thought that it's only when we're pulling, but when you press, the rotator cuff activates too. So we can get more rotator cuff with this as well. So that's a lot of movement. Another one that we're going to add tempo into, we're going to go slow on the eccentric. So you're going to go 3 count on the way down, quick pause there at the bottom, shoot up as fast as you can. So we're trying to get this vertical force vector explode on the way up. And then at the top, that's when you're gonna hit the paddle off press.
Right there, quick
at the top. Yep.
I like it. I was wondering what this would be. I was like, how are you going to incorporate all those things? It's hard to do that, and it really is. And again, it takes a lot to build on it. But I love that what we did with full body prehab, and at least, and people won't see this, but on our Excel sheets when we're designing this out, we kind of have a goal for each row, basically on an Excel sheet on what we're trying to hit. And those tendinopathies that you mentioned, we hit those every single session, every single week. We're making sure we're hitting the rotator cuff, the glute, the patellar, Achilles, making sure we're hitting all those points, because we know those are the most common injuries. When we talk about what can we do to decrease the risk of injury or for injury prevention in the full body, let's hit the things that we know have the highest relevance. And these tendinopathies are the things that people in the 20 to 50-year-old group, like our age, that are active. Maybe we're not like that 20-year-old athlete that we were, 10 years ago, but we think we are, at least. And we try to be like that on the weekends. Those are the things that, we're dealing with. And if we can incorporate that into our daily movement habits, or just make this part of our normal training, we're going to be able to really decrease the risk of injuries and make our bodies a lot stronger. So I like that exercise. I'm going to try that. I don't think I've ever done that. Definitely going to try it later today.
There's a lot of moving parts, but you end up getting like 6 for 1 or 7 for 1. It's like big bang for your buck. And I think we live in a world that people do want to move and they do want to exercise, but it's the time. The excuse is time. I don't have enough time to hit these areas. So I have this option that I can go do a bunch of heel raises, and then I can do a bunch of knee over toe work, and then I can go do a bunch of clamshells or whatever glute work you want to be doing. And then I can go do my rotator cuff work. And by the time it's 2 hours, right? To address all those areas in the way that they should be addressed. We want to be precise, right? Let's combine these things together, because this is going to be more realistic to your life anyway, right? There's not a time that you're only doing a heel raise, but not reaching for something, or you're just bending your knee, not carrying a bag or things like this. Like, we want to make it more realistic to what's going to happen in life, so that we have the specificity in there. And when we do that, we have a better transfer where people can live this life of longevity, because ultimately, why do we want to prehab the entire body? Well, so that you can spend time doing things that are meaningful, not spending time doing rehab sessions or having to get coached to get these things back. Like, we want you to be doing these things that you love. And that comes with taking a quick 20 to 30 minutes, and you can rehab your full body with these precise movements, and then be happy and go on with the other things in your day.
And I think that's what people don't realize. Like, I even had an eval last week, and he was like, yeah, my program takes me 2 hours. And I'm like, well, before we talk about anything else, we just need to talk about your program. Like, I'm not going to be able to add any more load or capacity in there, because you're probably already doing too much. But also, why are we doing so much? You don't need that much. And to go what you said, I love how, like, all of our, but that exercise is a great example, but all of the exercises we try to choose in our programs, we build up to that point. You do have to start at one point isolated. And then once the individual develops that competency, then we can start adding in multiple layers like this. And these twofers, like you described, like that was like a multi-fer. I don't even know. But like when we talked about the side plank, why we love the side planks, why it's in every single program, is because it's a twofer. Like, we're getting so many different things with one movement that we can save time. I don't have to do a cuff exercise. I don't have to do a hip abduction exercise. I don't have to do a core exercise. I can just do a side plank do it the right way, been taught and do it with progressions, do it the right way. And in 45 seconds, I will feel so tired, so burned if you're actually doing it the right way. And I love that in full body. Yeah, we started with my favorite one, the side plank, clam on knee in week 1. And then we end the final week with the star plank, which is like extremely hard to do, especially if you're really driving into the ground. But these twofers are huge. We talked about it too with the down dog. Yeah. Talking about it too with the down dog. Like, we can get so many things out of one movement if we learn the basics and then we put it all together, and then we can save time. Prehab should only be 20, 30 minutes a day at most. And it should just be incorporated into your normal S&C program. And hopefully we try to make it as easy for possible with our programming.
Yeah, the starfish plank got to be the most humbling exercise that I think exists. And if you're listening and wondering what a starfish plank is, you progress a side plank to the point that your elbow's straight, your hands on the ground, you're doing a full side plank, but then you lift your top leg up towards the ceiling where it's not weight bearing anymore. It's shocking how much in a side plank the bottom leg is working, but how much that top leg being stacked on there does help out.
It helps when you push. Yeah,
it helps. And then you take this away, and it's incredible. It is a difficult movement. It's a hard one to do. All right, Mike, one last follow-up question I have for you is that let's remove the restrictions, right? Where we said it's going to be 3 exercises. Let's add in 1, maybe 2 more things that you would put into this to just really overhaul the body. How do we further just fully prehab the movement system?
I love this. This was actually hard for me to do 3 because of the restrictions of no equipment or just a band only. Where again, we talk about prehab and it's building capacity. Half of the equation is movement variability in my mind, being exposed to different things, whether it's different tempos, movements. But the other half of it is just load. Can we put load on the body, and can we progressively overload that and continually add load to the body to make it more robust? So for me, that narrows things down to a barbell essentially, because it's the easiest way to continue to stack on load. So from there, I only have so many options to choose from. The two that most people are going to be thinking are a squat and a deadlift. So in my mind, I kept going, all right, which one would I choose if I had to choose one? And for me, it's the deadlift. And I chose it for actually a lot of reasons. I'm going to go with the deadlift because we talked about the prevalence of low back pain. That's number 1 on the list over anything else. Not that a squat doesn't address low back pain. It does. I know there's studies that you just have them squat and they do just as well as a core program, but it's the fear that's associated with deadlifting in people that oftentimes have low back pain. So if we can get them confident with lifting heavy weight from the ground, we're going to be able to address that. The second thing with the deadlift is that I feel like, I hate to use the word more functional, but it is more, I think it's more functional in day-to-day life of us having to stoop to the ground, pick up things, even carry, and we're not carrying technically, but picking up something to carry something. And then the third, I know there's a lot of stuff going around, about like grip strength and its correlation to longevity. Not necessarily that having grip strength is a causative factor for living longer, but if you have a stronger grip strength, it means that you're probably more physically active and you're having to do things with your hands. And I like the deadlift for that too. I think grip strength is an important thing for us to all work on. And yes, it is a correlative factor with us being physically active, and you need grip strength to deadlift. I remember when I first started deadlifting in college, I was like, yeah, my grip was what was giving out. I had to use like straps. Like that was like my limiting factor, and it's not anymore. And I'm happy it's not, but that was the limiting factor. So for me, it's a deadlift. For me, it's progressive overload with the deadlift. Of course, we can mess with all those things you talked about. Tempo, I could do deficit, I could do single leg, I could do staggered. There's a lot of other things we could do with it, but just the deadlift, that'd be me. Barbell deadlift. What about you?
I love that answer. And I'm going to give one exercise and then one activity. So I'll start with the exercise and then move to the activity. If we were to choose one more, I'm actually going to go away from equipment, because talking about the broad jump, it made me realize I want something more explosive in here. So I'm going to go with sprinting.
Yeah.
Because you can change the distance, you can change the demands, you can do different on-off times, but sprinting is one of the best activities that we can do as long as the person's ready for that. I always joke around with athletes that I'm working with that, they want to do bicep curls. They want to do these things to get their upper body big. I go, okay, let's look at Olympic sprinters. How often do you think they're doing bicep curls? How often do you think they're doing shoulder presses? And they're jacked, like they're incredibly shredded. And I'm like, when you sprint, it's a full body activity. It's anabolic. You have all this lactic acid floating around. You have a ton of growth hormone and IGF-1 that's going to be released as a result of that, of working at that lactate threshold. That chemical soup is what's going to create the muscle growth through the entire body.
Correct.
So to become stronger, I'm going to sprint. I'm going to sprint as fast as I can, different distances, different on-off times, but sprinting is a great one that we can do anywhere. There's no restrictions on it. We can do it wherever, you know? So that's the other exercise I would add in. The last thing I would add in that we'll say this is more of an activity, but you mentioned load and you mentioned fear, and everyone listening is probably knowing where I'm going with this. And shout out to Lauren, who gifted me a trophy for the internal load regulator of prehab. But we have to do something to decrease the internal load. We have to bring down the internal load. We have to improve emotional resilience. We have to let go of some of the baggage and the stressors that we carry with us day by day. There's more and more research showing how much this impacts movement, how much this increases your risk for injury. We did a podcast with Rich Willey, who wrote the clinical practice guidelines for patellofemoral pain or anterior knee pain. And at the end of it, we were chatting, and he goes, we have to start looking more at psychosocial factors, because there's something in there that's bringing on this pain response. So if we're looking to fully prehab the entire body, we have to take care of internal load, whether that's through gratitude practice, positive self-talk, forgiveness, complimenting yourself, being out more in community, whatever it is that makes you feel more like a person. We need to do more of that. We need to let you have that escape from all the life stressors that we have. So definitely adding in some type of internal load piece that would be in that program.
I realize as we followed through this conversation, it shows a lot of these exercises, and I may have mentioned this at some point, but a lot of the things we chose are just things that we don't typically do. You know, when is the last time, and everyone listening to this can answer this themselves, when is the last time you sprinted all out for 5 to 10 seconds? You know, if we're not playing organized sports anymore, when is the last time we did that? And again, like that is such important. I started skipping again, like max skips for about 15 seconds. That's part of my lower extremity day right now. And oh my God, I'm so tired. I'm just burned out. But yeah, addressing the body in prehab is finding these things. When's the last time someone did gratitude practice? You know, it's finding these things that we know are supported in the literature and we know are important for longevity, and adding them into our day-to-day life or program, because it's not the sexy stuff. It's not the fun stuff. But we know there's a lot of literature and research to support them, and how can we incorporate them in a fun and effective manner? Like you said, that's only 20 or 30 minutes. And that's where I know for me, the full body prehab, I'm really excited for the program, because it's our best shot. It's what we feel our best shot is at addressing this for everyone. So they don't have to think about these things. We've done all the thinking, 6 months of thinking, and put it in an easy package for people.
Yeah, for sure. I remember grocery shopping a few months ago and walking out of the store. A father's walking with his daughter holding her hand, and she's skipping, right? She's just skipping, not for exercise, just to have fun. Like little girls, little boys, they like to skip. And I'm walking behind him, and I'm just enjoying this, because I'm like, what a great world it would be if we all just skipped more. Like in parking lots, everyone skip. And the dad looks at her and goes, can you just walk and be normal?
Yeah. Oh my God.
Oh, it crushed me, because I'm like, dang, like this is why people aren't skipping when they're 30 years old or 40 years old or 50 years old, because once they were told that skipping is not normal. Well, we're going to normalize skipping. Mike and I are going to be skipping in every parking lot that we go to. And it is a workout. It gets your heart rate up, and it's fun. I've never seen anybody skip and not smile.
I was just going to, you didn't mention that. I was going to say that. Yeah, you're happy. It's literally an expression of happiness. Like when you're skipping, like you're not happy. I've never seen someone frown and skip at the same time. You know? People
are going to be trying that now and sending us in pictures of like, look, I achieved it. I skipped while I was frowning. Well, awesome. Well, Mike, thank you so much for coming on today and having this conversation. We're so grateful for the talk. And I know I have the world's greatest stretch to work on. You're going to add in the single leg isometric heel raise pail off press.
with the tempo and the explosion on the way up in the press. Yes, I'm going to work on that.
Thankful that Mike is not in polar bear territory and was able to join us today on the episode for such a great conversation. Let's go over the main takeaways. Key takeaway number 1, we all have differing previous histories and movement profiles. If limited on the movement selection, make sure that it's individualized to your specific needs. Key takeaway number 2, make sure you're not missing out on all the benefits that a side plank creates. Key takeaway number 3, remember, your muscles don't know their specific jobs. They just know it's time to contract or relax. Furthermore, we tend to think of a movement that works a specific muscle group, but in reality, a lot more muscles are working than we can wrap our heads around. Prehabbers, thank you for listening. What 3 movements would you pick? Go ahead and comment below. Thank you for your support, subscriptions, ratings, reviews, and for sharing these episodes with friends and strangers. All right, we'll talk soon.